I'm Leslie from University of Alabama in Huntsville doing a diabetic foot exam for Nursing 500. First, we're going to look at the feet and the ortho aspect of the feet. First, we're going to look for digital deformities of the toes. We're going to make sure that none of them are curved under, no hammer toes. I don't see any on this patient. You also want to check the equinus or the heel cord. You want to make sure that the patient can flex their foot above 90 degrees. If they were not to be able to do that, that puts more pressure on the metatarsals, which can cause calluses and eventually cause wounds because on the bottom of the foot. You also want to look at the metatarsal heads on the bottom of the foot and make sure none of them, that they're all even and none drop down further than the other one. That they are when they're plantar flexed. You also want to look and make sure at the patient's arch to make sure that the patient's arches have not collapsed. This isn't painful, so you need to examine it closely to make sure. A lot of times people think that there's an infection there when actually it's just a collapsed arch. You want to look at the toes and make sure that there are no amputations. Next, you want to look at the skin. You want to examine the patient to make sure she doesn't have any athlete's feet. You want to look between the toes. If there were to be any kind of fungus, you would just provide some antifungal spray or antifungal cream for that. You also want to look at the toenails and make sure that there's no thickening or yellowing, and I don't see any on her feet. You also want to look at the feet for dry skin, especially around the heel areas. You want to look to see if there's any cracks, because cracks, you need to pay really close attention to those because those can lead to wounds if they're not addressed. And you need to remember that calluses happen before the ulcers on the feet. So if they have a callus, a lot of times eventually it'll blister and then that callus will fall off and then the ulcer will develop under that. You want to feel the temperature of the feet, both on the top and the bottom. I like to feel them both together. If one were to be colder than the other, then you may want to do a further testing for circulation, such as an ankle brachial index to test that. You also, excuse me, want to feel it like on the top of the foot. If it was warm, then it might be a sign of infection, or the bottom of the foot. If it's extremely cold, then that could be a sign of poor circulation. You also want to look at the hair distribution on the legs. It's harder on women than it is on men, but if there's any patchy hair distribution, then that could also be a sign of poor circulation. In this patient, there does not appear to be. Next, we're going to check the pulses. You want to check the dorsalis pedis first, and those are strong. You want to make sure that both pulses in both feet are fairly the same. One side weaker than the other could be a sign of poor circulation. Then you also want to test the posterior tibial pulse, and those both feel strong as well. You want to look for any kind of swelling in the feet, any varicose veins, and I don't notice any on this patient. You want to check the capillary refill. Make sure that it blanches and that it comes back to its normal color within 3 seconds. You want to do that on both feet. This is also a test for circulation. Next, we're going to check the feeling in the feet with the monofilament. The patient, you need to be able to, when it bends, the patient should be able to feel it. So you want them to close their eyes, and you're going to test their toes and the bottom of their feet. The main thing to remember is that you want to test them the same way each time, so you need to document where you tested this for future reference when they come back. So ask the patient to close their eyes. Close your eyes, please.
Yes. 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 Yes.
And make sure you test the heel as well. And for the sake of time, we're not going to repeat this, but you do the same thing on the other foot. If the patient couldn't feel this, then there's a greater risk for developing a wound, and they're also could be a sign that they are developing neuropathy in their feet, an early sign. You also want to test for sensation. You want to have an object that's soft on one end and dull on the other. You also want to ask the patient to close their eyes. First, I'm going to let you feel soft, and this is what dull feels like. And then close your eyes, and I want you to tell me which one it is.
Soft. Soft. Dull. Dull. Dull.
Okay. Next, you want to check the vibratory response with the tuning fork, and you want the patient to feel it as long as you feel it. If it stops in your hand, then the patient should say it stopped as well. If there's a discrepancy in that, then this should be, this could also be a sign that neuropathy is beginning. And for neuropathy, it's just a progressive disease. There's not a lot you can do about it. You can take extra precautions. There are some medications that you can give for it, but that help with some of the symptoms. So if you tell me when you stop feeling this.
I feel it. Stopped.
Okay.
Feel it. Stopped.
Okay. Next, I'm going to test the muscle strength. You want to ask the patient to push down and pull back. And you want to make sure they have good muscle strength in both of their feet. Also, going to test their reflexes. And you would expect those to jump, and she does have good reflexes in both of her feet. If the reflexes were absent or diminished, then this would be a sign of increased risk for ulcerations. You want to make sure that you tell the patient to examine their feet daily. You want them to wash them well and dry them well daily, especially in between their toes. You need to encourage them to look on the bottom of their feet, because a lot of times they'll get wounds, especially if they have neuropathy. They can't feel it. So then if they're not looking in the bottom of the feet, the wound has gotten out of control before they know that they have it. Many times that will lead to partial amputations of the foot because of the infection. You also want to encourage the patients that they cut their toenails straight across, and this patient did. You also, when you're looking at the toenails, you want to look around and make sure they don't have any ingrown toenails or any calluses around their big toe, or any toes for that matter. If you do notice that if the patient notices that they have calluses on their feet, then they need to be encouraged to go to the podiatrist to have those corrected or taken off, not to attempt to do that themselves. You need to tell the patient when they are putting their shoes on that when they put their hand in they need to put their hand in their shoe every time before they put their shoes on, to make sure that there's no pebbles or rocks or anything in there that they may not be able to feel, but that would cause a wound on the foot. You also can tell them that they can be careful with their socks, because a lot of times the seams in the socks can rub sores on the tops of the patient's feet, especially if they have neuropathy. They really don't need to wear open-toed shoes just to help protect their feet. And you need to also encourage them that they need to go have a yearly foot exam by a podiatrist one time a year. And that would conclude the diabetic foot exam.